Welcome to the KISSPrep lecture for First Aid, Basic Sciences, Organ Systems, Neurology. This is a collaboration between KISSPrep and First Aid, Organ Systems for the Basic Sciences. Please be sure to use your Organ Systems book and follow along. Welcome to the Keeping It Simple series for First Aid Organ Systems. This lecture we're going to talk about spinal cord tracts and lesions. The tracts are a complicated topic and people think there isn't a pattern. Well, there is a pattern. And the pattern is as simple as 4 words. And we're going to go over the 4 words now, and we're going to talk about what they mean as we cover these tracts throughout the lecture. So repeat after me. Say above, opposite. Above, opposite.
Above, opposite.
Below, same.
Below, same.
Above, opposite, below, same.
Above, opposite, below, same.
One more time.
Above, opposite, below, same.
Excellent. Above, opposite, below, same. So let's begin our discussion of spinal tracts by talking about the dorsal columns. So before we get into details about the dorsal columns, I want to show you a picture, and you see there in purple the dorsal columns. And we'll talk about the names of these areas and more details about the location, the anatomy, as we talk about the tract in a second. But I just want to give you an overview and show you that picture. Now, before we talk about the dorsal column, I want to say something and teach you something. I want you to repeat after me. So when I say pain and temperature, you say spinothalamic. Anytime I say anything else, you say dorsal column. Understand? So if I say pain and temperature, you say spinothalamic. Everything else I say, you say dorsal column. Let's practice. Pain.
Spinothalamic.
Temperature.
Spinothalamic.
Pain.
Spinothalamic.
Temperature.
Spinothalamic.
Pressure.
Dorsal column.
Vibration.
Dorsal column.
Touch.
Dorsal column.
Proprioceptive sensation.
Dorsal column.
Pain.
Spinothalamic.
Pressure.
Dorsal columns.
Pressure.
Dorsal column.
Vibration.
Dorsal column.
Temperature.
Spinothalamic.
Touch.
Dorsal column.
Proprioceptive input.
Dorsal column.
Okay. Pain and temperature.
Spinothalamic.
Okay. I want you to know that, and I want you to drill it into your head because we're going to talk about these tracts, and I want you to keep it straight. So when you hear pain or temperature, you think spinothalamic. Got it? You hear anything else, you start thinking dorsal column. Let's talk about dorsal column first. Dorsal column is an ascending tract. What do I mean by ascending tract? I mean that it's taking information in and up to your brain so you can feel this sensation, okay? And what sensations am I referring to? Well, remember I said pain and temperature, spinothalamic, everything else dorsal column. And in this case, I am referring to pressure, vibration, touch, and proprioceptive input, right? So we did that drill earlier where I made you say dorsal column or spinothalamic tract, and every time I said pressure, vibration, touch, or proprioceptive input, you said dorsal column. So dorsal column is an ascending tract responsible for feeling pressure, vibration, touch, and proprioceptive sensation. And it's taking that information and sending it up to your brain. It's ascending so you can feel these sensations. These sensations are carried by A beta fibers. They're carried by
A beta fibers.
Excellent. So there are 3 neurons I want you to know, okay? First order, second order, and third order neurons. So let's start with the first order neuron. When we do this, okay, when we talk about these neurons, I'm going to give you the text and explanation of what it is, and then I'm going to give it to you again as you look at a diagram of these neurons. So let's start off by talking about the first order neuron. First order neuron. The cell body is in the dorsal root ganglion, and we will just refer to that as the DRG. It enters the spinal cord and ascends ipsilaterally in the dorsal column. What does that mean? That means that it is still carrying fibers that are representing the same side of your body. So ipsilateral is just another way of saying same side. So when I was referring earlier to above, opposite, below, same, the same that I was referring to is actually the word ipsilateral. Okay, we're just going to keep it simple. So first order neuron, the cell body is in the dorsal root ganglion. It enters your spinal cord and ascends on the same side or ipsilaterally in the dorsal columns. The first synapse, and this is important, so we're going to drill it. The first synapse is in the ipsilateral nucleus cuneatus or nucleus gracilis. It's in the ipsilateral nucleus cuneatus or nucleus gracilis. Cuneatus or? Gracilis or?
Cuneatus.
Cuneatus or?
Gracilis.
Excellent. The cuneatus is more lateral, and is responsible for the upper body. The gracilis is more medial, okay, and it's responsible for the lower body, okay? So cuneatus is more lateral and responsible for the upper body. Gracilis is more medial and responsible for the lower body. So cuneatus, upper, gracilis, lower. Cuneatus,
upper.
Gracilis,
Lower.
Cuneatus,
Upper.
Gracilis,
Lower.
Excellent. And remember that cuneatus is only visible at the level of T2 or above. So you will see that more medially. The cuneatus you will see laterally at T2 or above. So we talked about the first order neuron. We talked about the first synapse in the cuneatus or gracilis is still ipsilateral. That means it's still carrying fibers for the same side. It has not crossed over, and they will not say crossed over. They will use the word decussate. It has not yet decussated. It is still ipsilateral. And now we're going to go and talk about the second order neuron. Now, the second order neuron, here you have the decussation. It decussates in the medulla. What does it decussate?
Medulla.
What does it decussate?
Medulla.
What does it decussate?
Medulla.
And then it ascends contralaterally. So now, because it decussated, it has crossed over, and now instead of it being the same side fibers or ipsilateral fibers, they have decussated, they have crossed over, and now they are opposite and contralateral, and they are ascending now to the medial lemniscus. So they decussate in the medulla and ascend contralaterally in the medial lemniscus. It ascends contralaterally in the medial lemniscus. It ascends contralaterally in the
Medial lemniscus.
Excellent. The second synapse is in the VPL of the thalamus. Now remember, all sensory information must stop at the thalamus. It must all go to the thalamus with the exception of olfactory. So don't forget that. So you got the second order neuron decussating in the medulla, ascending contralaterally in the medial lemniscus. You got the second synapse in the VPL, and your third neuron going up to your sensory cortex. Okay? So after the thalamus, you're always going to go to the sensory cortex. So just know that. So here's a diagram of what we talked about. You see the first order neuron there in blue. The cell body is in the dorsal root ganglion. It enters the spinal cord and ascends ipsilaterally in the dorsal column. The first synapse is on the ipsilateral cuneatus or gracilis. Then you have the second order neuron, and this is in red. It's decussating in the medulla, and you see it crossing over. You see it going to the other side, and then ascending contralaterally in the medial lemniscus. Okay? You see the second synapse in the VPL of the thalamus, and you see the third order neuron. You see the third order neuron in green going up to your sensory cortex. Now, repeat after me. Above, opposite.
Above, opposite.
Below, same.
Below, same.
Excellent. What do I mean by that? So here's the first example. A dorsal column lesion. A lesion in the cortex, in the thalamus, or in the medulla after the decussation is going to result in opposite loss of relevant sensations. Okay, so check it out. It decussated in the medulla, and then it went up, right, because it's an ascending tract. So when it decussated in the medulla, when it crossed over, okay, when it crossed over in the medulla, it started carrying opposite fibers. Everybody follow? So it's carrying fibers, A-beta fibers are carrying sensations like pressure, vibration, touch, proprioceptive input. They're all carrying fibers from the same side until they got to the medulla and they decussated. But after they decussated, they were carrying opposite fibers. So if you're above the decussation, which means you're above the decussation, which is in the medulla. Where's the decussation?
Medulla.
So if you're above the medulla, it's carrying opposite or contralateral sensation. So if you're above, it will be opposite loss. And that pattern is going to work for every single tract. If you're above it, it will be opposite. If you're below it, it will be the same. There's one tract that's going to confuse you. I'm going to talk about that in a second, but the pattern still holds. So you know those 4 words, you'll get every question right. So in this case, it's above, opposite. Say it.
Above, opposite.
So if it's above or after the decussation in the medulla, it will be an opposite or contralateral loss of conscious proprioception, fine touch, vibration, pressure, and 2-point discrimination. Do you see pain and temperature on that list?
No.
Every time I say pain and temperature, you say?
Spinothalamic.
Every time I say anything else, you say?
Dorsal
So conscious proprioception, you say?
Dorsal
If I say fine touch, you say?
Dorsal
I say vibration, you say?
Dorsal
I say
column.
pressure, you say?
Dorsal
I say
column.
two-point discrimination, you say?
Dorsal
But if
column.
I say pain and temperature, you say? But
Spinothalamic.
because we're talking about the dorsal column, we're talking about conscious proprioception, fine touch, vibration, pressure, and two-point discrimination. And if you are above the decussation in the medulla, above, opposite, it will be an opposite or contralateral loss of those sensations. Which means that if you have a lesion in the spinal cord prior to the decussation or below the decussation, it will be the same. Below, same, say it.
Below, same.
So we said if it's above the decussation, it's opposite, which means if it's below the decussation, it's the same. So say it again. Above, opposite.
Above, opposite.
Below, same.
Below, same.
So that means if it's below the decussation in the medulla, it will be the same side or ipsilateral side. So same or ipsilateral loss of those same sensations. And those sensations, again, were conscious proprioception, fine touch, vibration, pressure, and two-point discrimination. So if you have a lesion in the dorsal column, okay, you will have a positive Romberg test. So let's discuss the Romberg test, and then we'll review the dorsal column. What is a Romberg test? You ask your patient to put their feet together, okay? Put their feet together and close their eyes. If they start to sway with their eyes closed, that means the lesion is in the dorsal column. If they have their eyes open and their feet are together and they start to sway, that means the lesion is in the cerebellum. Why is that? Because when your eyes are open, your cerebellum, okay, can compensate for the loss of proprioceptive input. So if they sway with their eyes open, damage in the cerebellum. Closed is in the dorsal column. So closed, dorsal column, open, cerebellum. Closed,
Dorsal column.
open,
Cerebellum.
closed,
Dorsal column.
open.
Cerebellum.
Excellent. We talked about the Romberg test. We talked about dorsal column. We talked about dorsal column lesion. Let's do a quick summary, and let's move on to spinothalamic tract. So we talked about the dorsal column lesion. We said the manifestation of it will be loss of those sensations. We talked about those sensations are pressure, vibration, fine touch, and proprioceptive input. Okay? If it's above the decussation, it will be opposite or contralateral loss. If it is below the decussation, it will be ipsilateral or same loss. And we said that it will also manifest with a positive Romberg sign. And you can see this in tabes dorsalis or tertiary syphilis. So fill that out in your worksheet. And let's move along now to the spinothalamic tract. You see the spinothalamic tract there in blue at the bottom right. Okay? Spinothalamic tract. This is also an ascending pathway, okay? Now this is carrying pain and temperature. What is it carrying?
Pain and temperature.
Right, so remember earlier when I said pain and temperature, I made you repeat spinothalamic tract. We beat that horse to death, so we're not going to do it again. It's an ascending pathway carrying pain and temperature and taking that up to your brain so you can actually feel that sensation and so it can manifest. Now, what I want you to know is the fibers and what makes them different, and this is high yield. I want you to know it. With dorsal columns, when we talk about A beta, it's not that high yield. But in this case, it is, but it's easy because it's alphabetical order, okay? A delta, say A delta.
A delta.
A delta is fast. A delta is?
Fast.
Say C fibers.
C fibers.
C fibers slow. Say it.
C fibers slow.
What comes first in the alphabet, A or C?
A.
What comes first, fast or slow?
Fast.
Problem solved. A delta, fast. C fibers, slow. Why are A delta fibers fast? Because they're myelinated. Why are C fibers slow? Because they're unmyelinated. So let's talk about the neuron. So the first order neuron is your sensory nerve ending, and it enters your spinal cord, and these are your A delta and C fibers that we discussed. So that's your first order neuron. Your first synapse is in your gray matter, ipsilateral gray matter of your spinal cord. Don't worry about this right now. I'm going to explain to you why it matters in a second. So your first order neuron, we said, is your C fibers or your A delta fibers. Then we had your first synapse in the ipsilateral gray matter of spinal cord. Second order neuron decussates at the AWC. What does it decussate?
AWC.
And after it decussates or crosses over, it is no longer ipsilateral. It is now contralateral, which means it's no longer carrying fibers for the same side. It's carrying fibers for the opposite side. That's what decussate means. And it decussates or crosses over at the anterior white commissure, known as the AWC. Where does it decussate?
AWC.
If you forget, this is how I remember it, because when you have pain, you say what? Ouch, right? And AWC, if you put an H at the end of it, kind of looks like ouch. Okay? Cool? That's how I remember it. Now, second synapse is always going to be in the VPL of your thalamus before it goes up to your sensory cortex. All sensation must stop at your thalamus with the exception of olfactory. So you see in blue there your first order neuron, your sensory nerve ending entering your spinal cord, your A delta and C fibers. A delta are your fast myelinated fibers. Your C fibers are your slow unmyelinated fibers. And then you see your first synapse in the ipsilateral gray matter of your spinal cord, still ipsilateral, same side. And then you see it cross over or decussate at the anterior white commissure or AWC, and then it's on the opposite side going up to your VPL of your thalamus. And now that's in red. Now look how much blue you have and look how much red you have. Do you have a little blue or a lot blue?
A little blue.
A little blue. You know what that means? That means that these fibers come in and they decussate almost immediately. They decussate
almost immediately.
They decussate right away. That's why you see very little blue and a lot of red. They decussate immediately at your anterior white commissure. Then they're opposite and they ascend contralaterally. They ascend contralaterally. And you see there the synapse and the VPL of the thalamus. And then you see the green third order neuron going up to your sensory cortex. Now, repeat after me. Above, opposite.
Above, opposite.
Below, same.
Below, same.
Did this cross over right away or did it take it a while?
Right away.
It crossed over right away. Which means when you have a lesion, okay, no matter where it is, because it decussated and crossed over so quickly, that lesion is almost always going to be above the decussation. And we said above, opposite. Say it again.
Above, opposite.
And because it crossed over immediately at the AWC at your anterior white commissure, it means that you will always have contralateral or opposite loss of sensation, which in this case is pain and temperature. Okay? One thing you want to know about spinothalamic tract lesions is that this oftentimes will present with self-inflicted injuries. Why? They can't feel pain, so they'll try to do things to themselves to feel pain. Okay? So, our pattern still holds. Above, opposite, below, same. And because it crossed over right away, it's going to be above the decussation, which means it will be opposite or contralateral loss of pain and temperature. So now, before I begin our discussion of lateral corticospinal tract, once again, you see a picture and your lateral corticospinal tract is there on your left side. Before we do this one, repeat after me. Above, opposite.
Above, opposite.
Below, same.
Below, same.
Now, no matter what happens here, you're going to say the same 4 words in that order. Okay? Now, pay attention, because this is the one tract that's kind of different. But there's only one thing you have to know about this tract to keep it straight. And that one thing is the first point on this slide. Your lateral corticospinal tract is responsible for voluntary movement of your contralateral limbs. Okay? That means this must be a descending tract, right? Because information is not going from your brain down to your body to initiate movement. So as opposed to things going up to your brain so you can feel it, you are now having a message or a signal start in your brain and go down so you can have voluntary movement. Make sense? So this is a descending tract, and it's controlling voluntary movement of your contralateral limbs. Of what limbs?
Contralateral.
So what does contralateral mean?
Opposite.
Opposite. So this is already controlling opposite limbs. It's already controlling what?
Opposite limbs.
It's already controlling what?
Opposite limbs.
Excellent. Keep that in mind as we have our discussion. Your first order neuron. Upper motor neuron is cell body in the primary motor cortex. That's in the frontal lobe. We talked about that in the brain anatomy lecture. It descends, the descending tract. So the information is starting at your primary motor cortex for this voluntary movement of your opposite limbs and is descending on the same side or ipsilaterally through the internal capsule. Is descending ipsilaterally through?
Internal capsule.
Is descending ipsilaterally through?
Internal capsule.
First order neuron is descending ipsilaterally, like we said, through the internal capsule. And now it's decussating at the pyramidal decussation, which is in the caudal medulla. I love the name of this because it finally named something in neuroanatomy that makes sense. It decussates at the pyramidal decussation. You can't forget that one. It decussates at the
Pyramidal decussation.
It decussates at the
Pyramidal decussation.
It decussates at the pyramidal decussation, which is in the caudal medulla. Where is it?
Caudal medulla.
And then it descends contralaterally. Now, before we go to the first synapse, check it out. It's already carrying opposite side information. It's already carrying voluntary movement signal for the opposite or contralateral limb. And now it's decussating in the caudal medulla. So when something is already opposite and then it crosses over, what does it become?
Same.
Understand. It's already opposite and now it's crossing, so what does it become?
Same.
Right, so it's already opposite and now it's crossing or decussating at the pyramidal decussation in the caudal medulla and is now carrying what side fibers?
Same.
Same side fibers, and it descends contralaterally. That's the point I want you to know. You know that point, you get these questions right, and the pattern holds, and I'll explain it to you in a second. So first order neuron, we talked about, the first synapse is in the cell body of the anterior horn. The second order neuron, the lower motor neuron, leaves the spinal cord, okay? It leaves the spinal cord and synapses at the neuromuscular junction, or NMJ. Second synapse is at your NMJ, which is going to be where you're going to have that movement. So you see in blue there, the descending first order neuron coming from the primary motor cortex, descending ipsilaterally through your internal capsule, and then you see it decussating at the pyramidal decussation in the caudal medulla, synapsing at the cell body of the anterior horn. The second order neuron there in red, leaving, okay, the lower motor neuron leaving your spinal cord and synapsing at your neuromuscular junction. Now let's talk about lesions. This was an ascending or descending tract? Descending. It's a descending tract. And it was already carrying ipsilateral or contralateral fibers.
Contralateral.
It was already carrying opposite or contralateral fibers. So, repeat after me. Above, opposite.
Above, opposite.
Below, same.
Below, same.
One more time. Above, opposite.
Above, opposite.
Below, same.
Below, same.
Now check it out. If it's above the decussation, if the lesion is above the decussation, you still have opposite loss or opposite effects, which is opposite side loss of voluntary movement. Why is that? Because it's a descending tract and it's already carrying opposite side fibers. So because it doesn't decussate until the caudal medulla, if you're above that decussation, it's opposite because the descending tract above opposite, which means if it's above the decussation in the pyramidal decussation of the caudal medulla, it is going to be opposite or contralateral loss of voluntary movement. Above, opposite still holds. And the only way you're going to keep it straight is if you remember that it's a descending tract and it's already carrying opposite fibers. But once it gets to decussation, it crosses over and carries same side fibers, which is why if you're below the pyramidal decussation, it will now be an ipsilateral loss of voluntary movement. Above, opposite, below, same. The pattern holds for all three of these tracks. Anybody watch the movie American Sniper? Yes. You know they have that thing called the sniper's box? You know what that is? It's 2 inches right here. You know why they like to hit it? Because the second they shoot you there, okay, it hits your medulla, and boom, all movement stops. That brings us to the end of our lecture on spinal cord tracts and lesions.